So welcome everybody. My name is Edward Shin. I'm the CEO, co-founder of QReviews, and this is part of our live Quality Reviews webinar series. And it is my pleasure today to welcome Joan Kelly. And Joan, I've known for a while. Joan is the former Chief Experience Officer of NYU Langone Health System in New York and the former Chief Experience Officer of Yale-New Health System. So we have the benefit of two experiences. So welcome, Joan, today.
Great, thanks, Ed. Glad to be here.
So we wanted to just keep this free flowing, and you had sent me some notes, but I'm always interested in how folks get into patient experience. And you have a bit of a non-traditional route. So maybe you could just tell the group a little bit about your background and how you got into the world of patient experience.
Well, interestingly enough, I had no desire to go into healthcare. I didn't even know what patient experience was. I know that I wanted the root of business. My father was sick while I was growing up, so we had to build this ecosystem at home. He was a quadriplegic. And we cared for him at home. And as you can imagine, that means you're going to the hospital, you're taking care of everything. And for me, the only thing I didn't want to do was to go into healthcare. And I was on it from the other side of the fence. What worked, what didn't work, who we would gravitate to, even what doctors, because of the way they managed the care. And I went into business. But from the time I was young, I was always observing, right? We had to find out, is dad doing okay? What's going on? And then actually being in the system and watching it, I really observed human behavior. And that was my focus. How do we know what people are doing? People will say one thing, but actually do another. And being able to look at it from a system perspective is really how I got into healthcare, to be able to redesign at the time with Virgin. Virgin wanted to launch a wellness program, and they partnered with Humana to make it part of insurance. So the more you worked out, the more reward points or money you got. And that got me into the experience side and made me understand that those in the system don't always know what's happening and what's going on. And so as a patient or family member, you get frustrated, and there's equal frustration with staff. So I saw this, it was symbiotic, that a lot of the staff who were doing work didn't control all areas of the experience. And I lived in Louisville, Kentucky for 8 years and really just wanted to back to the East Coast, and NYU called. They were looking, as HCAPs came of age, they had to look and find out who already had been doing some of this work. And so that's how I got pulled in with NYU Langone.
Fantastic. So tell me a little bit about, very quickly, I mean, we're just going to go back and forth here, but you've worked at some, top kind of consumer product type companies like P&G, and you said Virgin, Disney. Just very briefly, like what in those experiences, what have you brought over into this world of healthcare experience?
I would say the first thing is to understand people. So what are their needs? What are their drivers? When you go from that perspective, then you can build what's right. And to be able to be intentional, know what behavior you want as an outcome, not just, and understand what is it for their whole journey, the entire time, not just one slice of it, but if you want better health outcomes, if you want patients to be able to manage their own health, then what is happening in that system? And what I found interesting with, for instance, first with Disney is they didn't mind continuing to look to make improvements. They kept refining and, observing for hours, seeing what's happening, even for instance, the line cues. How do you make that change? But how does it fit into, I always look at what are the two things someone is doing before and after. So say if you own one part of the touch point or experience, what's the mindset before and what's the mindset after? And it's knowing that it may change. Because when we think of patient access, someone wants to go to the doctor, they want an appointment, it's a different mindset than when you're being discharged from the hospital. So you have to understand that evolution. And that's really where I found the top companies, because they tended to be more capital focused, knowing it has to bring in revenue rather than let's just deliver a service.
Got it. So there is that revenue driver that kind of kept everybody honest, kept everybody focused. Yeah. And it's interesting what you said, they're interested in getting better, not necessarily being perfect, but being better than they were yesterday and the day before. So
Exactly.
Yeah. So talk to us a little bit about, I mean, obviously last year and even this year has been the word unprecedented. And you went to Yale, New Haven